Tonight, a strong warning from both state and Mecklenburg County leaders that the coronavirus pandemic is not over.
And the numbers we dig through and analyze for you every day prove that fact. First, take a look at this chart. It shows the daily cases in North Carolina. Today, the state reported 1,768 new lab-confirmed positive cases. That is the highest number of positive cases in a single day since testing began. And here in Mecklenburg County, we also saw a new daily high case total at 235. Health Director Gibby Harris said it is the 11th straight day of triple-digit cases reported. But she also reiterated that this is not a second wave of the virus.
Today, she said what we're seeing is a peak in cases that she predicted. Now, at first, she said late June to early July. Well, today she moved that back to between late August and early September. Our government reporter Joe Bruno is live now. He questioned Harris about her concerns moving into the state's next phase of reopening.
The county health director said a lot of people are feeling coronavirus fatigue, but she's stressing that COVID-19 is still here. At this point, things are not looking good to enter phase 3 in just 2 weeks. The county held a news conference this afternoon. It was their first one in 3 weeks about COVID-19, and basically everything is on the rise. That includes percent positive cases, which is coming in at about 10%, and hospitalizations. We are averaging 101 people right now. They said one thing that is not on the rise is social distancing. That's on the decline. More people are out and about, and pretty soon we could be at the same level we were before the stay-at-home order was issued. Based on the governor's timeline, we could enter into phase 3 in 2 weeks. At this point, though, Harris says that's not likely.
The way the numbers look right now, I would be surprised if we move fully into phase 3. There may be some additional restrictions lifted, but I really don't have a feel for that yet. The state hasn't given us any specific information on that. I do know that Dr. Cohen is concerned about the numbers.
Harris is encouraging people to wear masks and to continue to social distance. She says, though, at this point, a mask mandate is not in consideration because police have expressed concerns about enforcement. Back to you.
All right, Joe, thanks very much. Hospitalizations are also up in the state, but it's important to note hospitals are not overwhelmed. There are still plenty of beds available, and 72% of the state's ventilators are also still available.